In today's episode of the Future Focused podcast, Duncan Weatherston, the CEO of the healthcare technology platform Smile CDR, talks about how to build a foundation of security with a zero trust strategy in building a technology platform. Come check out all the insights.
Hi, everybody. Welcome to the next episode of Future Focused CXOs. I have a very special guest from the healthcare ecosystem who started his own company and has grown significantly, has tremendous experience in the healthcare space. So without any further delay, let me welcome Duncan Weatherston to our podcast. He is the Chief Executive Officer of Smile Digital Health.
Yeah, hi there. Thank you for having me. It's a pleasure to chat with you guys. I've come from a healthcare background for the past 30 years or so. I'm a techie by trade. I've done pretty much everything. I've been a developer, I've done administration, I've done all the elements of the technical environment, and specifically focused on the delivery of healthcare and the use of information in the delivery of healthcare. I started the business as a consequence of the challenges I experienced trying to build solutions as a techie. One of the problems that you have in healthcare is that we're very siloed and focused on specific areas of solution. And as a consequence, when you try to expand these capabilities out to a large scale, for example, 15 million people and hundreds of hospitals, all of the solutions run into problems scaling effectively. And more importantly, because they tend to be structured for particular purposes, the kind of general use you need when you're dealing with large population implementations tends to be challenging in these kinds of solutions. We started Smile as a consequence of that to build something that worked at scale with all the security that's necessary, all the privacy, all the compliance components you have to have, that can handle hundreds of thousands of requests a second or millions of requests a second if you need, that can handle all of the aspects of healthcare from acute to labs and drugs and diagnostic imaging and the primary care encounters and like just the whole gamut of health data. That was driven largely by need. So it was very easy for me to explain to people what we had to do and why we wanted to do it. So it made it a very organic growth. One of the things we were very lucky to do was we standardized on a new health information standard called FHIR, Fast Healthcare Interoperability Resources, when we started. And our justification was we needed to have a meta model for healthcare. And we were in the process of trying to figure out how to write one. And we came across this standard. We don't have to write one. We're going to use that as the core of our platform. And it's proven to be very effective for us. The standard works great. It became part of the vernacular for healthcare. And we ended up growing as a consequence of the combination of capability, standards, history, implementation. And so as a bootstrapped company, we grew very quickly and ended up in a relatively successful environment. It's been a fantastic journey.
Excellent, Duncan. Got a question for you. We talked a little bit about your background, and you have a large background as an architect in the overarching healthcare space in Ontario and Canada. So how did that transition into both managing that, and what did you learn from that? And then how did that apply towards Smile?
Yeah, architecture in the sense that I did it was incredibly informative in thinking about how you build a business. Because in these environments, the architect role is to understand the technology, understand the business need, be the go-between between a variety of stakeholders across different businesses. Your goal is to be able to manage the budget effectively on the things you're buying. You're basically like the chief operating officer of your project, right? I mean, you always have a boss when you're an architect and you always have someone trying to accomplish something, but they give you a task. And it's a pretty encompassing opportunity. And then you have to figure out how to take their objective and make it real. And so as somebody who'd been doing that role for 25 years, it was relatively straightforward for me to do that in our business when we started it. I was able to understand the characteristics of a small company because it's a lot like an architecture project. When we were 15, 20 people, I'd managed those teams. I'd built solutions in that space. When we were 50 people, I'd managed teams in that space. When we were in the hundreds of people, it had no preparation for me at all. I've had to rethink everything because what you do to try and coordinate a team who are trying to build a single product in a single state for a single purpose is very different from trying to manage a business that has hundreds of people, all of whom have different tasks, different objectives that are completely outside delivery, right? Finance is in there and marketing is in there and HR is in there. And the people you're managing are the people who manage the people you used to manage. The whole game changes. So the question you're asking is, how did it help me? It set me up for a small business. What was its hindrance? It made me believe I was prepared for something I wasn't prepared for.
Yeah.
See, I think I come from a very similar background. I'm also a techie and then started my own company, similarly 6-7 years back. So my question to you is, we've been excited about solving a technical problem. And you explained that's why Smile started and you're doing it. But there is also a personal side to it. Not everybody is courageous enough to top their paycheck and start a entrepreneurship because it's a lot of uncertainties, especially in terms of how much you're going to get paid. So how did you make that transition personally, and what age did you do, and what uncertainties you faced? And if somebody wants to think through that, because a lot of people do think through it, but they don't take action, how would you put that perspective together?
So I was lucky in the sense that I was only ever an employee for 4 or 5 years of my life. I went into consulting young, and I was always an independent consultant. Or consultant maybe a strong word, independent contractor slash consultant, working with a variety of agencies. And there was never any time where I felt I had security. I always had several contracts at a time to make sure that I had continuity and I was able to do the things I needed to do. I always was dependent on my ability to sell myself for the next deal. I've been a salesman my whole life, independent of being a techie. I've been a salesman my whole life. And so it wasn't a giant leap for me to be able to go to a business and do the same thing with a bigger team. In fact, in the 90s, I had a small internet business, went to 15, 20 people with two techies. And so I'd even gone through this process of starting a business before and having to operate and everything else. The thing I would say that is important to anybody who's thinking about starting a business is that there is risk and you have to be prepared for it. The worst thing in the world you can do to yourself is take yourself out of a situation you're comfortable and effective in and put yourself in a situation where you're uncomfortable and ineffective. And then as a consequence, also unemployed. That trajectory is a thing I would advise everybody to think through properly. And far be it for me to discourage people from going out on their own. I think it's a fantastic thing to do. And I think you can find great success, but it means you have to be prepared. You can't on a whim do it. You have to think through, what is the business? What are the things I'm selling? Who's going to buy it? How quickly are they going to buy it? How much effort is it going to take for me to get into a position where they're going to trust me to sell it to them? How am I going to move forward once I've gotten through my initial collection of friends and family and people are going to buy my product? How am I going to achieve the outcomes? What are the outcomes I want to achieve? How do I define success? There's so much thought you have to put into this. I encourage people to do it, but don't do it half-heartedly. It is an entire change in your life. And if you're not ready for that change, if you're not ready to take the risk, if you're not ready to put the hours in, if you're not ready for the unrewarding parts as well as the rewarding parts, really think twice.
But that's a fantastic advice, because many people think about just financial security, think that how much runway I have, 2 years, 3 years they have, and I want to do it. They don't think of all the other aspects you spoke about. Think that who am I going to sell? What am I going to sell? How quickly is somebody going to trust me to sell? And one thing I always keep telling people, it's not about whom you know. It's about who knows you, because those people are going to buy from you.
I love that. Yeah.
I always say that. And because if you look at, and sometimes I and Steve have this conversation when we are running low on our pipeline, Steve says, oh, just call your 10 friends. And I call 10 friends and I get 5 deals, right? So because they know me for 25, 30 years, obviously they trust me to do something for them. But that's a very nice aspect of somebody to think about, that it's not just financial security. You can build that, but it's also a lot of other aspects you should think about before you jump in.
Let me interrupt on that. You mentioned something, Duncan. You said as a company got to a certain size and you had to start managing people who were managing the people you used to work for. There seemed to be a change where you felt you were in new territory, personally and professionally. What was some of the things that helped you succeed at that level that you had to grow into to be more effective there, as opposed to from the technical architect side of things where you're in your zone?
I think succeed at that level might be a strong word for what I've done, but you'll have to ask the people who work with me whether I've succeeded or not. But the things I had to learn to accept are actually, there's a couple of things which are interesting. One is, I've always been somebody who believes in not micromanaging. I've always been the kind of person who feels like I'll have a conversation with somebody, explain what I want to do. If they want to ask me how to do it, I'll work with them to figure it out. But once I feel like we've got it done, I'll hand it off to them. When you're a small team and you're doing something where you all know what you're doing together, that works. One of the things I've done wrong as a leader of people who aren't in that boat is I've handed a conversation saying I want this thing, but because my new role, people expect that I'm now asking them to do everything themselves, and no one expects the CEO to want to talk technology, for example. The net effect is that I have done a disservice to the people who work for me because I ask them to do things I know what I want, but I don't properly express because I hadn't had that sort of level of information disbursement necessary in my past for the smaller things I asked people to do. The people I was asking were experts in things I asked them to do it. And now as a leader of people trying to express a vision. I would like us to figure out how we're going to solve global health problems. Here are some global health problems we have to solve. And I've got an idea how I want to do it, but my team are like, what the hell is he thinking, right? Like, and why is he asking me this? And, oh my God, how are we going to get there? And why is he even asking us, we're this size, we can't solve global health problems, we're only 200 people. So there's this character of request that we're trying to do where I have to be way better at elucidating the characteristics of the pathway that I expect to follow. Because I don't expect someone today to pick up my platform and go off and cure cancer in Rwanda. That's just not a real expectation. But I do expect that people in Rwanda will be cured of cancer because they have our platform. And so it's that pattern of a conversation where I have to be able to explain to people the distinction between what I want to accomplish and how to accomplish it, and then when to do the work that I was totally letting people down on. Another area is people don't want a completely hands-off leader. When you're in a small technical group and everybody's an expert in the thing, they do want you to leave them alone. When you're in a bigger team and you're trying to give people vision, you want to be there with them, they would like you to be there with them. They want to feel like you're part of what they're doing. And it doesn't mean that you're micromanaging them, but it does mean that you're sitting with them and you're talking to them and you're helping them. And as you get bigger and bigger, it's so hard to do that because you have hundreds of people. I would love to spend every day with all of my team because they're all amazing people. They're all trying to do great things and they're all insightful and thoughtful, and I enjoy being around them. But the reality is we're distributed, we work from home largely, we're all trying to accomplish things, and I have a day job as well sometimes. And so the problem is I don't get to do those things as effectively as I'd like. And again, another thing no one teaches you is how to be effective at working with people you're not directly working with and being able to inspire them and to give them the faith that you have in them and to do all that sort of stuff. And so there's been a steep learning curve on those things. Quite frankly, I can't say I've been successful at it. I can say I'm trying. And you say, how do you try? First is to acknowledge the problem. You have to recognize you're doing something wrong. And then you have to listen to the people who are around you. And most people don't want it. When you're a CEO, no one wants to tell you what you're doing wrong because they're afraid. They're like, oh no, if I tell him something, he's going to hold it against me. It's really weird because you have to come to terms with that as well. I'm just Duncan. I feel like I've always been just this architect guy who does things. He's got some ideas. I'm trying to accomplish goals. But how you see yourself and how others see you is not 100% overlap. And as you become a larger and more diverse company, people don't know you. They don't get that experience. They can't say, oh, it's just Duncan. The people who worked with me when we were 10 people were quite happy to tell me I'm an idiot. Nowadays, it's pretty hard for me to find people who tell me I'm an idiot. I have to coach it out of them. Like, how am I being an idiot? Where's my idiot? Find it. And so I'd say like those things are the ones that help you and get there. I'm trying as hard as I can to be a good leader and to be a good manager and to be a good person in these environments. But I can't say I've been 100% successful. The secret is the journey.
Oh, yeah. I loved it because I relate to that a lot. I also started on your same path, right? So this time, when I went to India and met my team, 40% faces were new to me because we hired so much in the year. Earlier, I used to know everybody. And we used to have conversations, stand there, talk. This time, I really felt a little different because when I'm walking around in the corridors, talking to people, a lot of people who don't know me and I don't know them, they are very fearful that, oh, the CEO is talking. But I did experience that, but good insights you gave of getting to terms with that and trying to work to people whom you don't directly influence or report to. And as you're right, it's a journey. I don't know, success, it's a very hard to measure.
Yeah, and I think part of being a leader is being at the head of a marching band. And so you're like out there with your batons. And if you forget that you're actually at the head of a marching band, you think you're just walking by yourself, you'll turn a corner too quickly, you'll go down an alley the band can't fit through, and you'll be the only person in the band and the music will fade off into the background. I think as a leader, your job is to keep yourself in front of the band, and the band is deciding as much as you are where the trajectory is going to go.
Wow, that's a very good insight. Thank you for that. Some of the products did not scale, and it happens. To us also, it happened. So the question is, what lessons you have learned from them? And more importantly, how has that shaped your ongoing strategy?
We were from inception built to scale. So our platform is designed from day one to be a scalable platform. That was driven by the fact that I'd encountered all of these other platforms that couldn't scale. When we designed Smile, we built it with the idea that it was going to be highly parallelizable. Let me talk about scalability for a second. I think that I did do a bit of a detour, but I used this example with somebody the other day and it was effective. When you think about scalability, imagine you're trying to get people in and out of New York, out of Manhattan every day. And so you say, well, that's easy to do. I'm just going to make a big ship. I'm going to put everybody on the big ship. But what you realize immediately is the big ship only has one door onto it. And if you get everybody in Manhattan trying to get on that big ship, it doesn't matter how big you make it, you're still constrained by the pathway into the ship and out of the ship. So, okay, wait a second, this isn't working. I'm going to bring 1,000 small ships. And so now you try and put 1,000 small ships into the harbor. Every time you do something, you think through, oh no, I've got this problem, that problem, the other problem. Scalability is about building a subway and a street system and a taxi system and a bus system and a dock system and a harbor system and controllers for all of it. And the people who think through these problems and an ongoing effort to monitor where things are changing. Scalability is about building a New York transit system, not a ship to get people out of New York. And what we do as a business is think those things through. So when you get to the end of it, you're like, someone says, why should you buy Smile? Because we've built transit systems for healthcare. You get all of the parts, you get the controllers, you get the docks, sometimes a big ship's necessary. That's the thing we talk about scalability that we do. That was the part that I learned. When you say, what was your journey? My journey was initially, I thought I was building a big ship. And then I thought I was building small ships. Then I thought I was building 1,000 small ships with harbors. So the journey for scalability is realizing there is no one answer for it. You have to be able to build a thing that meets the need of the city you're building to. But you also have to have good ships, and you also have to have good taxis, and you also have good routing and everything else. So for me, when you say, how do we think about our journey? It's that realization.
That pushes something I want to talk about is at some point as a technical architecting things, you're building a ship that hopefully floats and gets people across the water. But at the same time, now that you're building a system, all of a sudden everybody's got an R&D budget.
Yes.
And you, of course, obviously, as the CEO now, you're in charge of the financial side of things too. So it's like, how do you balance the requirement for innovation to build an effective transit system with the fiscal responsibility of being able to pay everyone every day?
So this is a bit of a journey for me. Unfortunately for my timing, I decided to take investment in 2021. And 2021 was a great year with high valuations. People were willing to participate. Everyone was optimistic. So I went on this journey of, okay, fair enough. I'm going to do lots of R&D. And I'm going to build some big teams. I'm going to build some big operations. We're going to do a bunch of things. Prior to 2021, I had EBITDA. I was bootstrapped. We were a very tight fiscal ship, and we were going forward. 2022 shows up, and in the journey from 2021 to 2022, halfway through 2022, people are like, you're doing great. You got this giant valuation. Look at all the growth you've got, because we had lots of growth and everything else. November of 2022, everybody said with SoftBank and SVB stuff and everything else has changed our worldview. What's your trailing EBITDA? I'm like, what do you mean we're trailing EBITDA? I just went a year of spend everything to grow, and now you're asking about trailing EBITDA? How about you just ignore the last year? I got a trailing EBITDA the previous 4 years. And so the challenge on this kind of innovation was, I think you can do innovation in a market that's throwing money at things. Look at AI right now. Everybody's getting money thrown at them. It's much harder to do innovation when you also have to worry about profit, because those two things are a little anemic. You have a big R&D team, they cost money, and they're not making money because they're doing R&D. And you have a bunch of clients who are eventually going to show up for it, but they're not going to pay for a half-finished product. So you're stuck in a situation where you have to spend money. What we've had to do is then narrow down what we're doing R&D on to things that we think are going to be essential to our clients, not so expensive that it's going to break the bank, and then come up with very creative and intelligent clients who get the value prop of what we're building and are willing to put up with a little bit of the challenge of being at the leading edge. The secret to being able to be innovative in an environment where you don't have a pile of cash that you're sitting on, which is the world now, is being able to understand the character of what you're developing, who it's valuable for, the steps to go through to continue the value on it, and then build the value prop by parts. So imagine you're building a home. First thing you want to have is a room you can walk into. Maybe you put a bed in there, maybe you have a door into it. You've got that. You can sleep in that, you can rent that. And then you're like, I should probably have a kitchen. You still live in the room with a bed while you build the kitchen. And so I think you do the same thing with the product. You have to be like, this product has value. Here's a set of capabilities that are going to augment the value that we're delivering. I'm going to build the steps along the way. You can still have my core product, but now you've got some additional value, and you sell the additional value on top of your product. That's how we thought about R&D and innovation at Smile, because the things that we're doing are all for healthcare. We have a healthcare platform, so they're all augmentative, but I've had to cut back some of the more adventurous activities that we were trying to do because there was no direct path to revenue for them. And so I think when you say, like, how do you do it? You can go out and you can raise a bunch of money, and you can have people who understand that you're going to spend some cash to try and do the thing you're trying to do. You have to be in the right market for that. I don't believe that we're in a great market for that right now. So if you're not in that great market, then the next thing you do is you figure out, how do I take what I'm earning? How do I pay for my food that I earn today, basically? And that's the part we've been doing. We're walking a very fine line. I have 3.5 core R&D areas I'm working on. We have our core platform we're doing R&D on. I have a clinical reason we're doing R&D on. I have a set of services for CMS that are coming out that we're doing R&D on. And then we have a pervasive AI strategy across our company that we're doing R&D on. So the model we have is short-term value in one sense and then long-term value in the second sense. And we try and balance those two concepts.
Balance. But a follow-up question to you. If you look back, you raised some funds, and that's another big milestone. A lot of entrepreneurs who do bootstrap, run a very tight ship, come to a point where saying that, should I raise money? Should I not raise money? So if you look back with your experience and would like to advise somebody that what are the things they should look at before they say, oh, I need money?
I think the most important thing is understanding what you're trying to accomplish and why you want the money. So we were building a platform that solved the problems I was describing early on. And we realized about 3 years in, we'd overachieved every goal we had on building a platform. Within 3 years, we had done what we would hope to do in 5 years, and we're thinking about how we go forward. Because we were ambitious and the thing we want to do is help change healthcare globally, it's not a thing you can do as a small company. And that's, for me, the first question. Can you do the thing you want to do with the company you have now? Or do you need to think bigger and be able to go after a bigger goal? And ask yourself, finance the impediment to my achievements? Because it's not always the impediment. Sometimes you could be like, I have this bigger vision. I want to do something that is very transformative, but I don't have that today. I would say if you've got it, you should really carefully think through, does your goal need money? If your goal doesn't need money, don't get the money. You're diluting and you're going to have a problem. Yeah. I think the second thing you have to ask yourself is, will the money I get be better as dilution? Will I get something from a partner who's coming? Think of taking money from somebody the right way. Don't think of money as a pile of cash you're going to spend. Think of taking money as bringing a partner in late in the game, and their penalty for being late in the game is they have to give you more money than you did when you started the business. The right way to think about it is, now the time for me to bring a new partner on. And if I'm going to bring a new partner on, how are they going to help me achieve my goals? I'd say that's the most important part of taking some money, because what you find yourself doing is things that are unnatural for you as a small company trying to get big. Your partner can help you avoid the obvious mistakes you're going to make. I think that is the second question. Is taking money going to get me a person in the door who's going to help me understand things I couldn't understand before? And the last thing you should think about when you're taking money, is it better for me to do this with dilution, or is it better for me to do this as a loan? Because if you know how you're going to make some money, if you know how you're going to do your trajectory, a loan in the long run is going to be cheaper money for you, because you'll pay back. Let's say you're a business doing $10 million a year of business and you want to grow. And so you think, oh man, it's going to be a lot of money. I'm only doing $10 million a year. I need $5 million. When you borrow $5 million, if you know how you're going to spend that $5 million to become a $40 million business, you'll find yourself now a $40 million business with your $5 million that you're going to pay off, but $5 million to a $40 million business is substantially less, kind of almost irrelevant. It's not irrelevant. Think about the interest payments relative to your revenue. If you've got a decent margin, you're not really stressed about it. And then if you think about the next step after that, you grow to 50, 70, 90 million, whatever, that debt you incurred at the start gets smaller, and the value prop that you were going to sell for, think about your $10 million business. You say, my value in modern times is say 60 million, whatever, that you're going to be able to do. If you bring someone in for $5 million, you take a 10, 15% hit on ownership. And that 15% of a $100 million company is a $15 million valuation, a $15 million value. So if you think about the growth from a 10 million to whatever. So the net effect is you end up with very expensive money. If you're just doing it for money, think about the loan pathway. I would totally advise that. If you're doing it for the right reasons, for partnership, for growth, for experience, for bringing the bigger situation to the table, for one of the things I would strongly suggest, when you get an investor, make sure that they're able to help you go down the institutional pathway. Because as you get bigger, the smaller investors fall by the wayside and the bigger investors want to participate. But it's much harder to get that kind of institutional money if you don't have institutional money. So the negotiation, that's part of the partnership. Can they help me do these things? I would strongly advise anybody who's thinking about it to weigh all those factors before you make the decision. And then when you make the decision, be very confident about it and find the right person. This, I think, is a really important lesson for anybody who's growing a business, because it's not obvious. The right person is not the right person right now. The right person is somebody who's going to be adaptable and able to change as you change. When we were 15 people, we had no titles. Everybody got to write their own title. I gave a bunch of people titles like VP and director and what have you. When you're 350 people, which we were for a period of time because we took money, those people who were managing 3 people and are now VP of whatever are no longer sufficiently experienced to be VP of 300 people. Because you made that decision early on that you thought you're hiring the right person because they're great people, you love them, they're fantastic, and you still do. You get to your stage where you're doing this and you still love those people, but you're stuck in this conundrum where they're not able to live up to the things that the company needs them to live up to. That's true for investors, that's true for staff, that's true for clients, it's true for everybody. So when you're thinking through how you're going to do what you have to do, be aware of that challenge and prepare for it. when you get your investor, make sure it's somebody who's going to be flexible and able to grow with you and is going to have a role in your journey. Don't think of them as your journey. When you're hiring your team, make sure they have a role in your journey. They're not the journey. They're the participants in the journey. Some of them maybe. I've got a few people who work with me who have scaled wonderfully and who've grown through the entire process. But that's not the norm. That's the aberration. So be aware of that going in and do everything you're going to do with that in mind.
That's incredible information in the fact that, as I've seen, as businesses are trying to grow, and a lot of the tech firms, we're a high tech area in our community, is they're always looking for investment, but the importance of a good investor, they have to interview that investor as much as they need to get the investment, because that partnership can kill them. And I've heard of stories where the wrong investor, basically the CEO is like, I should never have taken that money. That was the worst thing I could do. Hearing how you do that, assuming that the investor needs to have a role in that business, is a great way to start to eliminate those that want to profit off your business, as opposed to the ones that want to grow your business in a meaningful way that doesn't just translate to profit. It translates to effectiveness, which is a different KPI, which you're chasing as an owner. But as an investor, they may just be like, how can I get the parts and make a lot of money? So that's brilliant. Thank you.
I was just going to say, it's a great thing. Thank you for the advice, because I always keep saying to myself that don't take dumb money, just pile of cash. And you made a very important point. You changed my perspective that giving equity is an expensive money versus taking a loan. We always think other way around, because most of the time you might have to give some personal guarantees to get that loan. And that scares us, saying that, oh, I think equity is better than getting a loan. But the way you explained it, I think loan is better, less expensive money than equity, because it's like a marriage. You have a partner who should come with you for the growth and not look at your company as a profit center. And how much disbursement am I going to get? I don't care what's happening here.
The reason I say I'm unlucky here, the two people who invested early in my company were, one bought out one of my early partners, and he is a godsend. He's just a fantastic human being. I can't talk highly enough of the person who's become the chairman of our board. He's just a spectacular man. The second investor was the person who founded a competing product and had sold a substantial portion of his shares and was thinking about how would he use that money effectively. So my second investor was in my business, understood what I was doing, and had gone through the journey I hadn't gone through yet. And he kept trying to advise me, and me being a bit dense, I didn't quite understand the advice I was getting. But in retrospect, it's helped me over and over again. I think through the things he told me, and I use that to guide how I do stuff on pretty much everything I'm doing as I go through this journey. So I was very lucky. I didn't know the advice I was giving now when I was doing it. And I happened to luck into a couple of partners who are just stellar and fantastic and have helped me do everything I need to do. But yeah, I think that is the last essence of things that we can't put our finger on. I don't like quoting cartoon movies. I'm not proud of it, but in The Incredibles, there's Edna Mose, and she says, they ask her, what do you expect to happen for the baby? And she's, I don't know, darling, but luck favors the prepared. You can't discount luck in your journey. You have to be prepared for it. And you have to be aware that at some point it's going to show up. You can't be unlucky forever. When it shows up, you have to be prepared to seize the moment. That is the secret to successful business. You can't do a successful business if you're unlucky. You have to be in a situation, like think about all the businesses, they got the right timing, they had the right friends, they had the right whatever. You could be like, oh, they were so lucky. No, they were prepared for the luck they got. Be aware of it and be ready for it and use it.
Jay, I would say what I think I got with you, Duncan, about the difference between a loan and an investor as well, is if you know how to get there, a loan is cheaper. If you're not sure how to get there, an investor might actually be better if it can get you there. So you need to make sure you get the right investor to help you get to where you don't know to go. But if you do know specifically, oh, if I do X and Y and these 5 things, I'm generally going to get where I want to go, a loan is the cheaper route. It's just about how you view your current future situation and how well you feel you can do it. If you don't know, get someone to get you there.
100%. When you said dumb money earlier on and smart money, that's the difference. A loan and dumb money are the same things. One's just more expensive. A smart money participation where you're getting money, but you're getting expertise and depth and advice and all those things that help you become a better company as you grow. That's absolutely the value prop. And that's the decision you're making when you go to money. I couldn't agree with you more.
Thank you so much. I want to change the gear a little bit, because you're also involved with the Ontario Laboratories Information System. So talk more about it, what they do. Why did you get involved with them? Let's start from there.
Sure. In terms of Ontario, I can only talk about the things I did as a consultant because our current business is really a thing I can talk about. But OLIS was actually the first place I went to that was a substantial project with the government. Previous before that, I'd been doing contracting in smaller components. OLIS, the Ontario Laboratories Information System, was the first big thing we did in Ontario. It was gathering all the labs from all the laboratory companies and consolidating them and making them available to the provider community and ultimately to the patient community. You can see your own labs now. The journey there was about resolving the semantic challenges that come from the way labs are named. If you think about the way that we deal with a laboratory, you can imagine a blood bank kind of order or something which is, a set of blood tests. If you ever look at your blood test orders and you do them in different places, you will see they look nothing alike. So you'll see the names are different and the things they measure are different. They'll measure concentration, they'll measure specific molality. There's a bunch of things that kind of describe how they weigh things and how they evaluate things. You'll discover that the reference ranges are different. On this lab, having a number better than 6 is a problem. On that lab, having a number worse than 3 is a problem, and it's based on the equipment they're using. There's just a ton of interoperability challenges. So when I did OLIS, what we were doing was we're bringing this data in, we were consolidating a bunch of information. It was right at the early stages of commercial internet in the sense that the 90s was about getting people on the web, 2000s was about really institutionalizing the functionality. And so we were institutionalizing functionality in a consolidated data store at a time when everybody was worried about security and privacy for things that were connected to networks. There was a large portion of what we we're trying to do that was solving that problem. And then there was the general sort of engagement from how do you build a system that's going to be able to support all the transactions. And OLIS was the first place I discovered that nothing works. I'm not going to name any names and shame any companies, but we've changed the technology 3 times and eventually just rewrote it ourselves, like in the province, so that OLIS is actually a custom platform now versus something we bought because nothing we bought worked. It couldn't scale, it couldn't keep up. All of the things that you care about as an architect didn't work. So that OLIS is now, and OLIS is a superstar story. When COVID happened in Ontario, because of the lab integration, it was a no-brainer to know all the information about the distribution of vaccines and the flow and everything else. That infrastructure was already all in place. And so it was very easy for us to accommodate the population health problems with immediate reports. We were able then also inform the authorities and everybody else about the status of the disease, the flow, and all the things that we care about. It was also a demonstration of effectiveness of these large consolidated systems in population environments. I'd say OLIS was informative in possibly every way that you can be informed. It was when I was young enough that I was able to be impacted by it. And so I think OLIS was a spectacular deal for Ontario and for everybody involved. It's been useful beyond its value for many years, and it's really demonstrated the power of population health strategies or for large consolidated strategies for populations in a way that is referred to globally. People come to see OLIS from all over to see how we did and what we did.
How did the privacy, obviously, as the internet and the technology keeps adapting, privacy and security has been such a major component of healthcare. How did you weave that in, or what sort of unique things did you discover as you were going through building OLIS?
Interesting. That's a good question. I was actually hired as the security architect for it. I was intricately involved in that piece. Just a quick aside on this. There is a lesson here that everybody should learn who are doing architecture. If you make a policy and people adhere to that policy, expect that it will outlive your grandchildren. The number of policies I made at the time that I regret putting in stone as policies, you need to think about sunsetting. And the thing is, when you look at real policy writers, not architects, they know these things. What we did in OLIS was we assumed that from a security perspective, everything was vulnerable. So in our model, we had what is today called a zero trust strategy. We didn't believe any device. We don't believe anything is uncompromised. And we made an infrastructure that required all of the information coming in to be authenticated. We believed 100% that you can't expect that you know ahead of time what's going to go wrong. So we made a policy of record everything. Our logs were as big as our data or bigger than our data. We made a policy of very restrictive access. The people who get access to data are not the people who work on the project. They're only when you need to have access to data type people, and a bunch of other things along those lines. Well, we were working in the early days of, like I said, the commercial use of the internet. I've been involved in the internet since '93, so I had a history there, but in the commercial use of the internet. And so there was a bunch of anxiety about technologies that in the long run proved to be well-founded. So things like, is the encryption that you're using going to survive the next year? And encryption in 2003 seemed solid, but over the years, there have been a lot of updates to the standards in encryption to be able to support some of the more aggressive ways we're trying to break encryption. So I think that type of thing, building your thoughts around that was something we learned. How do we make sure that we were able to be future-proofed? I wanted probably to go a bit too far as my job as a security, when you got to hammer everything's a nail. I probably wanted to go a bit too far on the security side because I was new to healthcare and I was trying to accomplish goals that were driven by my security perspective. I think that's the other piece that's really important that we learned in that is when you're dealing with something like healthcare, there is an inherent risk that the data you have is going to get compromised because you have to share it. We have this problem. Your health data is incredibly personal to you, and in general, someone accessing your health data inappropriate feels a violation, like you feel violated as a consequence of it. On the flip side, you're quite happy to stand in an elevator and tell the guy next to you, I'm just recovering from COVID and I broke my leg last week. And all those conversations, we are actually pretty comfortable with sharing our health data with pretty much anybody in earshot. You're in a hospital, your chart's there. So we have this weird paradigm in healthcare where the data is incredibly personal and inappropriate access to it feels like a violation. It's also stuff we really don't care about most of the time when we're disclosing it and we're in control of it and it's something that we want to share. And so you have to build systems in healthcare that accommodate both those characteristics. You want all your doctors, your nurses, your care workers to have your information, but you don't want them to know everything about you last time you went to the bathroom because that's your private business specifically. I think that it's that combination that we've had to learn in healthcare, and Olus was a really great introduction to it, and I was probably a bit overzealous there. We ended up, wiser heads prevailed and diminished my impact. I went on my journey better. So here's the theme in my life. I'm always the problem. I always try to figure out how not to be the problem as I get better at what I do.
That's a great thing.
How can I be less of a problem as I grow?
Yeah.
Yes, I love it.
I love that. I'm writing down certain of the things that are coming up. So, because one thing also you said, luck favors the prepared. I think it's a very good statement to remember. But that brings me to my next thing. Looking forward, what trends do you see shaping up healthcare, particularly in data aggregation and in accessibility?
Prognostication is always a risky thing. So anything I say about where we're going to go in the future, take with a grain of salt. But I think there are some trends which you can see absolutely. You can see a chain of mountains on the horizon. You can't describe the things that are on the mountain. You can't tell you where, which parts are dangerous and which parts are good, but you can see the mountains. So let's start off with just talking about the mountains first, which we can see. It is clear that automation is going to transform healthcare. The combination of information and automation is going to change the nature of healthcare for everybody because healthcare is an information business. We don't know it because we don't act like it is. Your diseases are information. Your vital statistics are information. Everything we measure about you is actually information. Where the information meets fact is where you use automation to evaluate what the characteristics are of your health and how you're going to then treat it. And we're so used to that being such a complex interaction that it requires people. If you think about it, imagine trying to create a rules engine. If someone shows up with this and they have that and they have this, by the time you get to the bottom of that process for interacting with a person, you'd have to have a trillion rules for all of the use cases. And so it's been problematic to create automation. What we have now is a perfect storm in terms of technical capability, AI for the soft part of it, getting data out of you, doing the high level evaluations, having the conversation, and then the ability to use AI to generate rules that are calculable, validatable, believable, repeatable, all of those things that are important. So if you think about what the future looks like, it's the conflation of our AI technologies and our existing knowledge around rules and this giant influx of investment in interoperability and the character of humans and their interactions changing. I think the future holds for healthcare what tellers held for banks. If you think about where you want to talk to a person at a bank, it's maybe if you have to negotiate a mortgage, no one wants to negotiate with a computer screen. But outside of that, in things that aren't negotiable, you don't want to deal with a person because who really cares about disclosing your financial status to the person in front of you? They look at your bank book, you have to talk to them, you have to stand in line. There's all this stuff that goes on that's unpalatable. Healthcare is the same. You have to walk into an office and have a team of people be aware of your most intimate details. And I'm saying we're fine with sharing our intimate details, but on our terms. When you're doing healthcare in person, it's not on your terms. So I think there's a trajectory here. People say, oh, no, everybody wants the human touch. No, they don't. No, nay. They do not want a human touch. They want a solution to their health problem. That humans have to touch them is a necessary component of it. Where they want to have deal with people is in the negotiation of how to think about their condition, how to think about their pathway, how to think about the options associated with it, the way you think about consulting an expert. And I think that if you look at the mountains in the future, healthcare is about a set of very well-trained experts who can communicate effectively to people about the needs of their care and work with systems that are very accurate and very conclusive about the options that the patient has. And then, having worked with them and shown them how to do what they're going to do, you're going to see that the patients then take control of their journey because the automation and the patient work hand in hand. The evidence of this, clinicians are starting to learn this lesson the hard way. Clinicians have often said in the past, oh no, people want my soft touch, they want my conversation. And then their trial after trial have shown that AIs are more compassionate, more comprehensive, more timing, and patients rate AIs as much better interactors than people. So you can't fall back on, oh yeah, my stellar bedside manner is the reason people want to talk to me. What they want you for is your deep knowledge and your precedent. I've gone through this before, I've done it, I understand it. So when you think about it that way, that's really the journey for healthcare. I think there's a second thing to think when you think about healthcare. We're going through on the technology side in healthcare, in the way we think about immunology and the way that we think about personalized medicine, or the way we think about the analytics of that information, of the ability to understand the very nature of the patient we're dealing with. So that is in its nascent stages, and it's transforming monthly. Every couple of months, you hear there's this new discovery in precision medicine that enables you to do something that was heretofore impossible. And there's a new use of AI and tooling and protein folding and everything else to create a new class of medicine. Think about the GLP medicines. These are transformative things. They've popped out of nowhere, and they're so useful on a dozen things, and they're just the first of a wave of things to come. So when you see the mountains in the distance, you know that it's going to be advisory, but the things that we're advising on are going to be transforming very rapidly. So what we know is that the value prop that healthcare is going to bring is a very targeted healthcare experience for patients, driven by automation, driven by detailed knowledge of their full biology, their genetics, their microbiome, all the stuff that goes on as part of being a human being, their immunology, and all of those sort of characteristics. And then the conflation of that with new technology, new therapies, and new treatments, and then an expert class helping all of us navigate this complex environment, because it's going to be very hard for us. The thing that's most important about this entire thing is trust. Trust is one of those things that you can talk about, right? You trust your mom. Everybody knows what trust is. I trust the bus driver, but I don't trust the bus driver implicitly. I trust the bus driver to drive a bus. An example of this trust: when a bus driver drives up, I don't necessarily know the driver. He's wearing or she's wearing a uniform, and they appear to be employed by the company. I know the company's not out to kill people, so I get on the bus. If that same bus pulls up, smashes into a car, veers off into the oncoming train, and then pulls up in front of me, it won't matter how qualified I believe that driver is by his uniform and the fact he's in a bus. I'm not getting on that bus. So trust is well established. We know what trust is. Healthcare has a weird view of trust. It's going to change over the coming years, because the expectation that you trust your doctor is there. But what does that mean? You trust your doctor for what? When you know that AI can do a better analysis of your illness, when you know that automation can do a better analysis of your illness because it's got all the facts about you and it knows all the details and it can do that complex computation that a person can't, what do you trust the clinician for? What you trust the clinician for is their experience of 1,000 patients like you. And so when you think about what does that mean, it means in my mind that clinicians become globally active, because to find 1,000 patients like you, I need to be treating 1 billion people, not 1,000 people, not 1 million people. And so the combination of technology and integration, I think if you look at in the far distance, the mountains are highlighted behind the mountains, what is that you end up with this transformation in healthcare from a local kind of model. Obviously, local has to exist for things like specimen collection and the physical interactions, but the real meat of it has to become a kind of global solution. We're going to have this idea that my care is very specialized for me, and these are the people who get it for my type of thing. And we're going to have a transformation in the way that we think about the delivery of care, from being a mechanical process to a consultative process in deep understanding of particular patient need. And I think the clinicians who can achieve that will end up much like YouTube stars with an endless supply of business. And I think it's going to be that kind of a dynamic as we go forward on the far horizon. So those are my 2 cents on healthcare.
I'm actually a cancer survivor, but I got
Oh,
my diagnosis from a surgeon. So I got a surgical solution,
right.
only to find out later that I might not have wanted to take that path. So I always go into a situation. I told a friend his daughter was going through a situation. I was like, are you talking to a surgeon? You're going to get a surgical answer.
Yes.
There's someone else you should have a conversation with before you make a decision about surgery, because they're not going to talk to you about the potential, what happens after, what
Right.
risks are you taking, and they're going to be less inclined. And the surgeon is great with their hands. They're often bad in their personal. The bedside manner is terrible.
Yeah.
So you have to think through, like, how do I build a network of advice around me so that I can have the best decision? And the internet is way better than when I was going through that. So it's really interesting because you're saying that, yeah, I want to be able to command the amount of information to the right kind of people, and then also be able to get some sort of counterpoint as alternatives and then help guide me through that process is looking for in
Exactly.
healthcare, even though I think of it as more transactional on a day-to-day basis. So
Yeah.
interesting thoughts.
Actually, it's really important. I'm working with a group, Sequoia, who are a nonprofit organization that is trying to figure out a variety of aspects of healthcare. They do a bunch of other things. And one of the things we're working on is the patient focus of information. How do patients get their information? How do they interact with it? And today, even today, one of the speaker yesterday was describing the journey she went through trying to get her data as a person who knows the law and her rights and everything else, just to get the information she needed to be able to make decisions. So, like, to be able to go talk to other clinicians about her experience to get more than one person's point of view was so challenging. She ended up having to quote legislation that the provider didn't know about to get them to move and give her the data. And then eventually, because she had the force of law behind her, they had to give her the information, but they were quite willing to let her not have information for the process she needed to go through. So the process you go through in their environment to get the information that they need to be able to get their care is constrained and restricted. That's the thing that's going to change. That's that part on the mountains we can see. Everybody will have their information to be able to make the decisions they want. And that transformation from being a supplicant to being the consumer is going to be the transformation. And ultimately, think about what that means. The consumer gets the power in the relationship in the future, and the character of healthcare is going to be consumer driven, patient driven.
Interesting. Hey, we need to wrap up. And we always ask this question of every CXO. What advice would you give to someone thinking about your journey in what are the things that made you successful? What advice would you give someone who is working towards this type of leadership in either healthcare or just in general as a company as it's growing that really seems to have carried you through?
Geez, that's a tough question. The thing is, the people who are on that journey are all self-motivated, intelligent. They're people who've got an objective. And trying to give them advice is a lot like trying to steer a professional athlete. They're better at their job than you are. I can't tell anybody how to do their job in a way that is going to be changing for them. So with that sort of groundwork, take everything I say with a grain of salt. I think the most important thing that you can do for yourself on the journey is examine direction you want to go and examine yourself in the context of that direction and be prepared for fundamental changes in the way you do things. Because if you don't, if you can't transform yourself the way your business is transforming, like I said about the band, you'll turn the corner and the band will keep walking. You can't lead a business without changing yourself. What does that mean? I don't know. Maybe you get nicer, maybe you get meaner. I don't want to tell anybody to be what they are. But you do, the one thing that is really important is intrinsically who you are at the start of your business is not the person who can manage the business when it's successful. So if you want to be that person who's taking it the entire journey, be prepared to change yourself 100%. You are the problem.
Love it.
Thank you.
Thank you very much for having me. This has been great.
Thank you so much, Duncan. And yeah, we look forward to sharing your story and just seeing your success at Smile Digital Health.
We'd like to thank you for listening to the Future Focused CXO podcast, where we bring insights from future-focused leaders right to you.